Hi, I'm Dr. Danielle Marr and I'm Clinical Director of DermaFace Skincare and DermaFace Clinics. And somebody asked me about Botox, where to inject in the forehead and the crow's feet. So it's quite specific to each patient, but I can kind of do a general guide and a few tips and tricks. I should actually be charging for this. I've definitely done my 10,000 hours. So when it comes to Botox, obviously you've got your 11s here. So you'll have probably 5 units will pop in here, maybe 2.5 here, 2.5. Then depending on the forehead, I tend to just do two units. It does depend on the forehead, but this is for me. A little sneaky is like a half a unit quite high up here and on both sides. That stops ptosis, which is a droopy eye. In the event that you get a droopy eye, it'll normally go after 4 or 6 weeks, and there's also eye drops that your clinician can provide you with. And for the crow's feet, I actually, honestly, confession, I promise you, and I know I need my Botox done, but I did have Mohs surgery. I don't know if you can see, about 6 weeks ago. I should have had the Botox done before I had the surgery. It would have actually really helped with the scar, because if you actually have the area immobilized, then you can't stretch the scar and it'll heal better. But anyway, I had a great job done. So I don't want needles near me at the moment. I'm a bit queasy, so I am going to hold off getting my Botox. What I use for my crow's feet actually is my triple peptide eye cream, which has lots of oligopeptides, and I haven't had crow's feet Botox in a long time, but if I was, again, I get the patient to smile, and again, 5 units, 3 units, 2.5. A little trick is you come around the corner like maybe a half or a quarter. And again, you can always benefit from a little sprinkling of Botox here for smoker lines and to prevent smokers' lines. If you have a gummy smile, again, 2 to 3 units here and here, but again, very, very experienced injector. Also, if you have nasolabial lines, often inexperienced injectors put product here, and as they get further down the nasolabial, they put more product, which is crazy because it just droops everything and pulls it down. Remember, we want everything up in the face. We want to restore the V shape, the youthful V shape. So when it comes to nasolabials, often if you can ask your injector to do a perpendicular and put in a bolus of the product in here, and also if you have that done first and they leave it 3 or 4 or 5 minutes, the lidocaine in the filler will actually numb the area, and then if they do bring it down here, they can taper it off, and again, it won't be as painful, it'll be better.